What's going on, everyone? Happy Monday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long-term issues. It is time now for the Monday edition of the Pandemic Update for Monday, December 18th, 2023. That's right. Exactly 1 week from now will be Christmas. All right, first off, if you're new to my channel, welcome to my channel. This is where we do the daily COVID pandemic update. I try my best to do some sort of an update revolving around COVID and other viruses each and every day. So if at the end of this video you learn something, you like what you see, give the video a thumbs up and subscribe to my channel down below. And hey, share this with anyone who needs to see this. All right, starting off today, we're going to do just a couple news stories. We got some new data out of BNO. We also have the Walgreens update, and we didn't do our wastewater update yesterday, so we're going to also include some wastewater data as well. Starting off with this, if you're a football fan, maybe you're a fan of the Philadelphia Eagles. That happens to be the team here in my city. Well, this is making news all across the country. Philadelphia Eagles quarterback Jalen Hurts, he's currently sick. And the game is tonight. It's 8:15, Monday Night Football. We are now at 5 o'clock on Monday. We still don't know if he's going to play. He first started getting sick last Thursday. It was sick enough that he did not make it to practice. He did not travel with the team to Seattle. He traveled on a separate flight, and he was downgraded to questionable yesterday. His illness has gotten worse. People are saying it's not just a cold. It's not the flu. It's still being called, quote, illness, but he's having fever, chills, he's having aches and pains. I mean, it's sounding like COVID, but they're calling it illness right now. And it's just another example that I wish they would at least say if he was positive or negative for COVID. There are so many cases that we see out there where it's just illness, and maybe it's legal reasons, whatever the case may be, they can't say the words COVID, and this possibly could be one of those situations. Moving on to this, someone who did say they had COVID, matter of fact, two people. Hillary Duff gives health update and says, COVID-19 has been brutal this time as she shares selfie from bed after announcing fourth pregnancy. So here's the deal. She tested positive for COVID last week, right? Her husband did as well. Well, at the same time, she's pregnant. And now she's saying that, hey, it's not good this time. Look at this. She's actually in bed. She does not look well at all. So she's saying, yeah, it's really sick and that it has been a rough go-around this time. So, yeah, COVID, my friends, to those who think, oh, it's just a cold, it's no big deal. No, this wave right now, this JN.1 wave, it's causing some pretty significant illness. And we can also make the case here that it says COVID has been brutal this time. So that's meaning she may have had another case. I don't believe I have it archived on my site, but I will do some research and I will get it archived. When I add this case, I will make sure to add a previous case if I find it. All right, let's get to some BNO news. First off, Florida reported more than 10,000 new COVID cases this week. That's up 60% from last week. Nearly 19,000 people are currently hospitalized in the United States. It gets worse from there. New York State reported more than 26,000 new cases this week, up 28% from last week. And now for the weekly number, which is the weekly numbers, which are not good. Weekly U.S. COVID update. New cases, 274,398. That doesn't include all the people that don't get tested, those at-home tests, just people that are sick. Like I said, don't get tested. There's a lot of people that will not get tested for COVID for some reason. I see people arguing, saying, oh, I don't need that. It's just a cold. It's just a sinus infection. It's just allergies. It's mind-boggling. So these cases, this 274,000, we know that number's off. But for reported cases to be that high, that's not good. The actual number is probably over 1 million cases right now, as detected by Wastewater. This now brings the average number of cases up to 229,430 cases. That's up by over 22,000, almost 23,000. 50 out of 50 states reporting. Number in the hospital. This count says 18,233. That's up by 601. In the ICU, 1,902. That's up by 84. New deaths, 1,693. The death average is now 1492. That's up by 102. Yeah, deaths are continuing to, they're going upward. We don't like to see deaths going upward, and this is now the 14th week in a row where deaths were over 1,000, and there have been more than 20,000 deaths during that same period. Not good, and I think pretty soon we're going to see some days where deaths are over 2,000 in 1 week, if not higher than that. All right, let's take a look at today's air qualities. Not much to speak about here. The places that have been having bad air quality in the West, that continues. The rest of the country, not doing too bad. Not sure what's with these sensors that always come up red in the mid-Atlantic and parts of the Northeast, actually. There's a few here that are red. There was a big storm system that went through the Northeast. Very windy. You may hear the wind in the background behind me. It's been very windy here today. We had almost 4 inches of rain last night. Just totally incredible. And yes, is flooding that's going on. Taking a look at this. Walgreens. Yes, you're seeing that correctly. Walgreens COVID positivity actually went down. But let me explain. First off, the current positivity is 29.2%. Prior week was 29.5%. Down 0.3%. But testing did go up. Testing is 22,167 versus 18,139. That's a significant testing increase. And hey, it was enough that it actually brought the positivity down ever so slightly. But as you can see here on this map, not everywhere is dropping. Let's just do just a few states. Massachusetts, bright red. What's going on there? 36.3% positivity this week, 24.8% last week, up 11.5%, 179 tests versus 149. New Jersey is coming up bright red. What's this about? Current week's COVID positivity is 31%. Prior week was 24.5%. That's up 6.6%. Testing's also up as well. 877 versus 597. So, yeah, big testing increase, but yet the positivity still increased. Now let's go to the opposite side of the country. California's positivity actually dropped with the testing increase. 33.9% versus 37.7%. That's a difference of down 3.9%. Total test, 629 versus 567. Then we come up here to Washington. Positivity is rising in the state of Washington. 27.3% versus the prior week, which is 25.1%. That's up 2.2%. Total test, 231 versus 231. Testing's flat, but hey, the positivity went up, and cases could be going up as well. Nebraska, 41.2% positivity this week, 31.5% last week. Difference of up 9.6%. Total test, 119 versus 111. And let's just do one more state. Florida, 29.2% positivity versus 29.5%. Wait a second here. We're reading the national number. We want to read Florida. Florida is 24.2% versus the prior week, which is 22.2%. That is up by 2%. And the total testing, 2,106 versus 1,673. Now let's take a look at a few of those wastewater sites. First off, we're going to take a look at the CDC here. And what we see here is that new sites in the white, 128, 0 to 19%. Unfortunately, there's not many of them. Only 45. There's a reason for that. Then you get to 20 to 39% COVID. That's 104. 40 to 59%, 278. And then look at this. 60 to 79%. That's these orange sites. That's at 399. 80 to 100% COVID. That's at 310. These orange and red sites. And predominantly in the Great Lakes and Midwest region, there is a huge problem. There is a massive amount of spread of COVID. Look at Nebraska. We just did Nebraska on Walgreens. Yeah, it's not looking good here either. Utah, look at all this orange. There is like a whole corridor which is just covered in orange and isolated red. That's not good. That's really high COVID. And now let's take a look at the wastewater levels by state, not by site, but now by state. And look at these dark blues that are up here in the Midwest and Northern Plains. Those are very high levels of COVID. That's not good. That seems to be our worst area right now. And also portions of the Northeast, New England. New England is very high. That's not doing well either. We're starting to see levels come up a little bit in the southern states, but they have still not reached the very high levels. They're at the high levels, but not very high. South Carolina and North Carolina being an exception, another exception being Arkansas. Florida is still only at moderate. We'll have to see if that comes up higher. But again, anywhere north of the line that would be right down the middle of the country, northward, yes, you're just seeing very high levels. Like the I-70 corridor on northward, yeah, you're not doing very good right now with all these high levels. Please be extremely careful. Let's take a look at wastewater scan. Just going to take a look at a couple of these sites that show other things and not just COVID. Let's take a look at Salt Lake City. Look at this. I'm already seeing high COVID, high RSV, high influenza A and B, medium level for norovirus and HMPV. It exists. And let's see, is there any Mpox detection? No Mpox detection at this time. Let's go somewhere else in the country. Let's just continue on here. How about we come down here to Memphis, Tennessee? What's going on in Memphis, Tennessee? Let's see. In Memphis today, we see that high COVID levels, high RSV levels. Influenza A is low, but B, it's coming up low, but it is rising somewhat. Down a little bit on the most recent update, though. Norovirus is high and, wow, rapidly rising for norovirus. Low HMPV, no Mpox detected at this time. Now let's go over to New Jersey and see what's going on there. In the state of New Jersey, we're going to go right near New York City, Newark. This is a big wastewater site. Not only is COVID high, look at this. It is literally going straight up like a rocket now. That is not good. And RSV is high. That is also rocket shipping upward. Influenza A is low. Influenza B it's low, but it's starting to rapidly go up. HMPV, not much of an issue. Norovirus is high at this time, and it's been rising. Most recent update is down ever so slightly. And look at this. No Mpox detected in this area, so that is good to see. Continuing on now. Anywhere in this magenta or purplish color, these purple colors, is likely growing or is growing for COVID. And you can see the worst states are Texas, Oklahoma, Arkansas, Alabama, North Carolina, and Pennsylvania. So some of these southern states I just mentioned, such as Texas, the fact that it is in the growing stage, we suspect, or at least I suspect, wastewater will likely start to go up even higher in that area. HV.1 on the most recent update is 29.6%, JN.1 is 21.4%. I have to assume at this point JN.1 is at or over 30%, and it probably dominates. We'll find out the real number again on Friday. Taking a look now. COVID hospital admissions in the past week. 23,432. That's up 3.1%. Taking a look at Philadelphia. EMS incidents. 736 on Sunday. Taking a live look at the suburbs. Wow, there are a lot of calls going on right now. But not as many as there were about, say, 20 minutes ago. Before I started recording, this was actually up to 19 calls in Montgomery County, Pennsylvania. And taking a look at Chester County, Pennsylvania. Whoa, you know how sometimes I say it's not the volume of calls, it's the type of call? Not one, but two cardiac arrests, sick person, unconscious person, respiratory difficulty, and I see another respiratory difficulty and some other stuff mixed in between. So that's not good to see. New Jersey, only 60 out of 70 hospitals reporting, which is why you see the drop in hospitalizations. 667, 22 people on a ventilator, 86 patients in the ICU. Again, 10 hospitals did not report, so we know all these numbers are likely higher. Taking a look at New York State, tested positive. 3,408 people have tested positive for COVID. It's on the most recent update. And hospitalizations, 1,828 people in the hospital. And on the most recent update from Texas, we see there were 41 deaths, 1,233 people in the hospital, and 12,702 COVID cases. And then coming over here to Colorado, we know the number of people in the hospital has started to go up again. Washington State, COVID ER emergency department visits on the most recent update were down, but influenza was up on all metrics here, and RSV was up for hospital admissions. All right, taking a look at flu levels, and we do note the highest level of flu is in 2 states, Louisiana and down in South Carolina. They are at the highest possible color on this map, and I'm expecting to see these red colors and orange colors to start to spread more northward, especially as we head into the Christmas holiday. Again, folks, we are 1 week away from Christmas. If you wanted to quarantine because you're going to visit someone, you need to be doing that now, and you need to be testing yourself throughout the week. Test yourself multiple times this week, especially before you travel or go to a holiday gathering. Maybe it's Christmas Eve or Christmas Day. Take a test to make sure that you are negative, and please be mindful. If you have symptoms and your test comes up negative, consider you either have COVID, flu, an illness of some sort, and guess what? You have to cancel yourself from that event or gathering that you were going to go to because you were sick. Hey, you don't want to be selfish. Go because, oh, well, it was negative for COVID. I'll be fine, blah, blah, blah. And find out it was a false negative, and then everyone else starts testing positive, and eventually you test positive on another test. So, again, mask up this week. I know you may have last minute shopping plans, last minute this or that. You need to do it by masking up, and if you're sick, guess what? If you're positive with COVID, you're homebound. You need to quarantine. If you want to know what you need to do when you want to quarantine after you test positive for COVID, just watch my video that's down before this one. It's the video we did yesterday. We talked about what you should do when you test positive. All right, folks, that's it for today's pandemic update. We'll have another update again tomorrow. If you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. If you know anyone that needs to see this content, share this with them. If you have any comments, leave them down below. I love reading them, and I try to respond to most of them. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Monday evening.